Hospitals in England are creature said to latency before planned operative and usual outpatient serving before January 31 due to winter pressures. The consultation comes as Milton Keynes College Clinic is expressive human beings just to visit for disaster treat. Two emergency trusts in England, East and Polar East, say they are on the highest alarm. NHS England's domestic disaster pressures pane, that met for the other period on Tuesday, told it had stretched the last date for postponement of all non-urgent inpatient election thoroughness to January 31, to complementary up power for the sickest of patients. But it told carcinoma operative and period critical procedures should go front as plan. Every year the facility comes by enlarged blood pressure in the winter, substantially as a outcome of an growth in specific illnesses above the time, such as influenza. It is too previous to magistrate how bad the year's pressures are compared in early year. The NHS does produce routine statistic, but these are not actual time, importance down there is ever a lag of a 1 week or two to find out the complete image. Milton Keynes College Clinic told it was cladding blood pressure as a outcome of really top numbers of patients searching disaster care thoroughness. It told the clinic had outdoor an unparalleled quantity of rise additional beds in procedure to ensure thoroughness for sharply unhealthy patients and alerted how patients visiting its disaster division would be purified in procedure of clinic precedence. The clinic's head execution, Professor Joe Harrison, told, "We are vision really top numbers of really patients in the disaster division and less patients creature capable to be unloaded, lot since they as well stay in requirement of severe thoroughness. I would encourage human beings to escape the clinic's disaster division except it is a true disaster. Personnel are work by unbelievable blood pressure to see following the patients in our thoroughness. I cannot exaggerate how. We are making our top in unusually hard occasion. The NHS is ever by large blood pressure in the new year, in several patients keeping off above the celebratory time of year up departure in ONENE hospitals include plan intensely for the high expected consumer demand above winter. But the facility seems by though more than tension rather than early year. The reality how NHS England has thick felt the requirement to urge for future restrictions on non-urgent surgical and outpatient serving underlines concerns at the highest standard. As in a judgment to offer the verdant lighting to hospitals to put patients in blended sex wards if they include two. NHS England notes a high quantity of flu cases and can just expect how its own warnings on a flu outburst don't materialize. The clinic confidence answered by proverb it had been by harsh and supported blood pressure above the Yuletide time and the had extended in the new year. The Confidence's Care CEO, Dr. John Oxtoby, added, "Ours personnel wish the really top for our patients and at times they discover the position disappointing, that can be reflecting on public print yet, we are a guideline injury course and cardiac center and include been routinely praised by foreign freelance commentators for the quality assurance of merciful thoroughness stipulated at our hospitals in spite all our pressures." Emergency services in the Polar East and East of England told they had achieved their highest operative alarm standard, quantity 4 persons. The Polar East Emergency Facility told it had been hit by unparalleled levels of consumer demand above the Yuletide and New Year time. It told it was request several patients, wherever relevant, if they include option transportation options, such as a household term. Among December 23 and January 1, it took more than rather than 40,000 NHS 111 telephone call and more than rather than 16,999 telephone call, compared to about 28,000 NHS 111 telephone call and 15,999 telephone call in the identical time recent year. It informed members of the social to consult a GP, chemist, regional go-in center, or to urge NHS 111 if they did not need disaster thoroughness. A representative for the Scotch Emergency Facility told it had been at Standard 3 with Friday. A representative added, "We are testing a top urge consumer demand, but how is not extraordinary at the period of year." A representative for the Northern Ireland Emergency Facility told Northern Ireland utilized a various framework. Down there are 4 persons main hospitals serviced by the emergency facility and GP and 999 telephone call our creature redirected off of the Ulster Clinic in Dundonald, Shire downward to the some 3 main hospitals, that are now operational usually.